Hello everybody, my name is Jean Bastilla. I'm with AWC Home Care. Today again, we're coming back. As usual, you guys know what I've been doing is bringing a lot of health topics to help the community, to help educate our community about different diseases. Today, I know the last time we talked about depression, but today we'll be talking about an extremely important topic. This topic is so important that about 5 million of Americans suffer from this condition right now as we're speaking. We'll be talking about bipolar disorder. Bipolar disorder is also a disorder that is extremely important in our community. It is a disorder that we really have to be aware of the ways to help manage it, aware of the ways to know that somebody has bipolar, ways to diagnose it, ways to bring awareness about helping somebody, bringing them to where they can get the help that they need. So we'll be talking about bipolar, okay? That's very common disorder. So how many of you heard this term before? I'm pretty sure many of you watching this video right now have heard this term many times. You heard people say, oh, this person is bipolar. But you know, a lot of the time we use the term, but we use it very vaguely because we do not know what it means. We just use it. We just say, hey, that person is bipolar, and that's it. But we do not know why we're using the term bipolar. If you're watching this video, I'm sure you heard it so many times. So today what we'll do, we'll take a little time to sit down and talk about this condition and talk about different ways we can go about managing it, different ways we can go about reducing it. And this is exactly what we are about to do. I know some of you may be looking at me and say, hey, I thought this guy was focusing on seniors. Of course, I focus on seniors. However, we focus on the whole community. And also, many of our seniors are also having bipolar issues. So let's talk a little bit about bipolar. Stay with me and pay attention. You will learn some very important fact about bipolar. Well, bipolar is a disorder. You cannot talk about bipolar without talking about depression, which is the condition that we talked about the last time. And if you go to our YouTube channel, you'll see the last video we had about depression. Well, bipolar, we call it a period of highs and your behaviors and your temperament and your brain. It's just that period where you are like a high manic period, a period where you are very high. And when we say high, not that you are drunk, but you're high because that's a period where you're very energetic, period that you talk a lot, you laugh and all that stuff. So usually bipolar comes with depression because people, usually if you remember, the people would say, oh, you must be bipolar. Usually they would be friendly right now. They would be very energetic right now. And in a few minutes later, they will be very mad. And you're thinking, what did I do to you? Why are you getting so mad at me? So usually you have those periods of being so high, being so energetic, so happy. And then 2 minutes later, you become a different person. So that's why they say, hey, you know, you bipolar. But what happened is you have that deep depression, and sometimes actually we call it, you can have the mixed, where you both highs and lows. So you depress, but then you also have that energy. So those people really, any little time, they be very happy now, the next minute they're unhappy. And you're like, okay, what happened? So to me, it is very important. It's not as important to know what the condition is, but how do we help those people? How do we manage them? How do we help them in community? Because remember, those people, they are people who lives in the community. They are people that we see on a regular basis. But what do we do to help them? Okay, so when you see somebody who is at this period of highs and lows, well, one thing you can always do, you can always bring them to a professional, a healthcare professional, and you can bring them to the clinic, to any clinic where they take care of those issues. But we need to know, the first thing we need to know somebody with bipolar, they just have an issue. They have a condition. They need to be treated for it. They are not doing this on purpose. Because a lot of the time you're going to see this person is very, very happy. This person is very, very jovial. And the next minute you wonder what really happened to them. Wasn't that the person who was so nice to me? The person who was joking around? Why are they so mad right now? What did I do to them? And then you would wonder yourself. But if you know that, oh, that person has bipolar, then that would help you to manage them differently. That would help you to not look at them as, oh, they're crazy. Oh, I hurt them. Well, a lot of the time you do not hurt their feeling. It is just a question of being bipolar. It is, again, I know the last time when we were talking about depression, we talk about those neurotransmitters in your brain. So this is the same situation. So they are in a position where, and again, they are fighting with being happy and being sad. And usually the initial phase of being bipolar, most of it is usually being depressed. So they are in that depressive stage for a long time. And now what they're trying to do is fighting to be happy. They're fighting to be happy like everybody else. So they would take those few minutes and be like, okay, let me be happy. Oh, let's go there. Let's go do this. And the next minute you call them and you're like, what happened? Why you sound like this? But again, it's because they have bipolar. So again, what we do is to try to find ways to accommodate those people and community who have those type of conditions. We want to help everybody. We want to help every citizen in our community so they know how to manage those people. Because the last thing I want is for some people to look at somebody who is bipolar and think, oh, well, you are crazy. I don't want to have anything to do with you. Well, you do have things to do with them. What you have to do with them is to help them to find a healthcare professional, encourage them. Okay, it was so nice. Actually, this is a little side note, but the last 2 nights I work in the hospital, I have at least 2 patients who came in and they said, I came in here just because my friend pushed me and said, you have to come in. And really, those people, they really needed to be in the hospital, but they didn't want to. So what I want you to do is to be a good friend, be a good advocate. Don't be somebody who is saying, I was friend with that person, or I met that person even for the first time. Oh, because they have this type of behavior, I don't want to have anything to do with them. Don't be that person. Be the person who says, well, I know you have this problem. Let me try to find a way to help you. Again, bipolar, many people have it. And the best way you can tell is by seeing those people who have those highs and lows, those situations where right now they're happy, the next minute they are very unhappy. Right now they told you they had this plan, they want to go there, they want to do this with you, and the next minute you're like, okay, so what happened? You just told me something. What happened to what you just told me? And again, the best way to manage them is to try to understand their condition. The best way to manage them is to understand that they do have a problem, is to understand that it is not their fault when they are so high or when they are so low. Because again, it's that chemical imbalance that they have in their brain that's what causing them to be this way. They don't choose to be this way. And again, it would be a disfavor for us to say, hey, you are this way, I don't have anything to do with you, bye, I don't want to be your friend, I don't want nobody who is. But the best thing to do is to accommodate them, again, as I said. And again, this is my job is to talk about those issues so people are aware of them. So when you are aware of those conditions, then at least you try to accommodate the people with those conditions. You help them to live in community, because again, many of those people, they are not taking medications. Many of those people, they are not doing any psychotherapy. So they continue to have that same problem over and over, because many of them, they don't even know somebody out there can help them. So I want you guys to try to help those people instead of hurting them. Because when you try to distance yourself from them, actually all you're doing is hurting them. I want you to help them because they need help. All you have to do, actually, again, we are not I work at a community health center. I manage mental health as well. But if you call, I can at least give you a referral. It may not be where I work, but at least I can help you to kind of guide you wherever you need to be. Again, our number is 678-696-9905. Any education we provide, you can always call us. You can always ask questions. You can always tell us what you think. If you want to add something, you can always say, hey, Jean, you could have added this. I'll be more than happy to talk to you and listen to what you have to say. As I said, our education, we provide it everywhere. So if you know any community, especially community of seniors, we do a lot of the teaching in the nursing home, the assisted living. All those are free teaching for the community. So if you know anybody who is in need of some type of education, maybe they are taking care of somebody at home they don't know how to take care of. Again, we're part of AWC Home Care, that home care company where we provide care at home. We provide sitters and CNAs. We do like private sitting if you need somebody to help you with medication reminder, meal preparation, and things like that. We help you. But again, if you know anybody with bipolar, you need to help them find some help. Please don't judge them. Please don't look at them, don't laugh at them and say, hey, you crazy. We don't need to tell them they're crazy because they are not crazy. You may think they are, but they are not crazy. We need to look at them as people, citizens in the community who have issues, citizens in the community who need help, and our job is to try our very best to help them within the community, to help them find the resources that they are looking for, the resources they need so they can be part of community, so they can keep friendships. So one of the issue with those people with bipolar is that they become worse because so many people don't have much to do with them. They are losing so many of their friends. Many people who have deep depression and bipolar, when you talk to them, like many of my patients, they'll tell you, how many friends do you have? They'll tell you, I barely have any friend because I chased them away. And again, yes, the condition will make you chase them away. Not that you wanted to do that, but because you are so depressed, you have that high and lows, so it's very hard for you to manage friendship. So many of them, they become more depressed. Their family, their kids, nobody can live with them. Nobody can be friends with them, so they don't have anybody to go anywhere with. They had their boyfriend, girlfriend, everybody say, hey, you too crazy. I don't want to have anything to do with you and everything. So what I'm trying to do here is let's give those people a chance. Please, let's help them so they can be part of the community. Let's help them to live a productive life in society. Let's see how we can help them. Let's stop the idea of, oh, you crazy, I don't want to be your friend, and that's it. Because again, those people, they need us. They need somebody to be their friends, because most of the time, as I said, many of those people, they cannot keep friendship. It's very, very hard for them to have friends because of their condition. So what we need to do, somebody like you who is watching my video, somebody like you who knows about those conditions, somebody like you who knows that bipolar is not self-inflicted, but it is something that you have. It is like somebody who has high blood pressure. It is like somebody who have any other diseases. So because we know, what we need to do is to try to help those people. Sometimes don't mind them. If they say something, we have to try to be the person who knows what they're going through. We have to be because thankfully we are not bipolar. Or even if you're bipolar, you can still help them because at least you know exactly what's going on. But if you're not bipolar, at least you know, okay, they're doing this to me. I don't have to take it personal. It is because they have some issues. You address them, you say, ma'am, sir, mom, dad, friend, how can I help you? You know there's that place you can go. Why don't we talk to your doctor when we go the next time? Tell them this is how you're acting. and see if there's some medication they can give you. See if they can give you a referral, because that's extremely important. We don't want to make those people feel that they have no place in society. We don't want to make them feel like they can have no friends, because that is hurting them. That is hurting me when I'm treating them, because the more everybody's distancing themselves from those people, the worse they get. So even though I try to give them medication, I try this, I try that, but again, they do not have the community support. This is what I'm looking for. I'm looking for a community that supports our people with mental health issues. I'm looking for a community that supports our seniors when they get older. I'm looking for a community that don't judge somebody because they're old or because they have a mental health issue. I'm looking for a community who is there for their citizen when they have an issue, that they didn't inflict on themselves. When they have an issue, this is just what it is. So I'm looking for people to join me in that journey and that very, very important campaign of making sure we treat those people as we would have wanted to be treated. Make sure we treat those people as people who have issues, who have conditions that need help. Not as people who just like, oh, who cares? You old. I don't have anything to do with you. Who cares? You have mental health illness. But mental health illness, I understand there's a lot of work that have been done where at least we have more of a awareness about mental health issues, but we still have a big taboo about mental health. We still have a big stigma where people, some of them, they are afraid, they are scared of coming forward to talk to us and coming forward to say, I have those issues, I can't take it anymore, I need some help. So our job is to help our community. Our job is to help those people who don't want to come forward. When we notice those issues, don't be rude to them. Make a very nice approach. Make an approach that don't make them feel like we are trying to put them down. Make an approach that make them feel that we're there for them. Make an approach that makes them feel like we want to help them. And then tell them, hey, let me help you. Let me see how I can be part of the solution of the problem you have. And all you do is try to encourage them to talk to their primary care provider, to help them with giving them some medication or refer them to somewhere else. Instead of you saying, oh, I can't live with this person anymore because they are so crazy, because they are so bipolar. It's better for you to assist them. It's better for you to try to find out why they have those symptoms. Why they're happy now, the next minute they are so sad. Why they are so much your friend right now, and the next minute they are not your friend. So this is why I'm here, is to tell you that most of those people, they are like this because they have bipolar. They are like this because they have a mental health issue. They are like this because they have an issue that has to be fixed. And again, there are many things you can do, such as when you go to the doctor, they can refer you to psychotherapy. They can give you a psychotropic medication that can help you to manage your bipolar. So it is a condition that is manageable. I do have many of my patients that I see at the mental health center. They do have bipolar, and I'm able to give them medication that help them control their bipolar, that helps them to reconnect with many friends, many family that they lost because of their condition. So again, there is hope, there is help. They just need to know there is help. Don't make them get bitter about their situations, get bitter about what they feel, get bitter about them being bipolar, but help them by offering them an alternative, by offering them some help, some true help. That, okay, I'm going to have you go to that center. I'm going to call your doctor. Let's see how we can help you. So it is very important. Again, we talk a lot about seniors today. We usually talk about seniors, but today we talk more about general, but we have many of our seniors with that same issue. I don't want to make this video too long, but I want to say thank you to every one of you who was watching this video. Please, our bipolar people, help them in the community. Our seniors, help them. As I always say, help them to feel that they have a place in society. Thank you for every one of you who've been very faithful and watching my videos. Thank you for the people who share my videos, for people who call me and private message me about what I'm doing. Please join with me. Let me know if there's anything I can do differently. Let me know if there's any topic you think I should talk about. Let me know if you want to use our platform to talk about a topic. I'll be more than happy to sit with you and put you on the air and have you talk about a topic. The goal is to educate as many people in our community about different conditions, about our seniors, about mental health issues, about medical issues. And again, if you have any question, you can always call our number at 678-696-9905, or you can visit our website. We work for a home care company, AWC Home Care. The website is awchomecare.com. You can go to the website and get information. Also, you can visit our YouTube channel. It's AWC Home Care, 3 words. You can see all the past videos we have. We have been putting a lot of education, at least on a week, if not daily, on a weekly basis. We've been putting out new videos about education for our seniors, about safety, about education for our community in general, talking about different diseases, different ways of managing, of diagnosing different conditions. So you can visit our YouTube channel. You can follow us on Twitter, on Instagram. Again, share our videos, share it with as many people as you can. Thank you for watching this video. I want to say and wish you all a very happy evening. Tomorrow is Monday. You're going back to work. Enjoy your Sunday evening. Thank you again for taking the time to watch my video. I love you all very much. We'll be coming back with another topic tomorrow. Thank you very much. You all have a good night.